You know this, I know this. As a doctor in practice, communication with my patients is probably one of the most important features of the care that we provide to our patients. That partnership relies on good communication from us to our patients and from our patients to us. As technology has evolved, many patients are now very familiar with a patient portal or some interface that allows them to communicate directly with us. And in general, this has been a wonderful addition to the healthcare landscape in the last several years. But today we're announcing another shift, another change in expanding the access that our patients have to their medical records and to their healthcare providers. As I said earlier, this is not a change that is new to us. We have been working on this for several years now, anticipating when this day would come. And we're joining together with many communities across the country who are also undertaking this important change. But with any change, there comes a little bit of anxiety. There are always things that we have to address in terms of how we do our work. And in that sense, I want to make sure that everybody understands that both of our healthcare systems are on board. We're working together because even though we have two very strong healthcare systems in our community, we know that patients do get care from both. And so from my standpoint, it's very important that we are coordinated as a community. So in that perspective, I want to again thank my colleagues, Dr. Michael Apostolakis, Chief Medical Officer at the University of Rochester Medicine, and Dr. Robert Mayo, Chief Medical Officer at Rochester Regional Health. And I want to invite both of them to share their perspectives from the perspective of the healthcare system on what this change will mean for our patients and for our community.
I guess I'll go next. Thank you, Dr. Mendoza, and thanks, Dr. Mayo and the media for this opportunity to talk about this important and exciting time. Our portal at UR Medicine is called MyChart. It's our patient portal. And since it was launched in 2011, I'm proud to say that we've had more than 420,000 users of the patient portal. It represents about 50% of our patients. Through the portal, patients can view trends in their health information, as well as notes and instructions from their care team. And they can also send messages to their care team and get answers and needed help with medical questions. On October 11th, UR Medicine will begin releasing most test results and medical notes to patients immediately via MyChart. We've already seen the impact of immediate release with COVID-19, where during this pandemic, patients who are signed up in MyChart receive immediate notification of their results as soon as they're available from our testing centers. Imagine if this were the case for virtually all results, and that's what we're working towards here. As I said, immediate release of information is a positive change, but change can sometimes come with bumps in the road. And we're working with providers and patients to make this a smooth transition. As you know, at times, certain test results can be very concerning, especially if you haven't talked with a doctor who can explain what they mean. And up until now, sensitive test results that may come from imaging or pathology have been held and not released to patients until they've had a chance to talk to their doctor. Right now, starting October 11th, they will receive these results just as the doctor does. And they could receive a life-altering diagnosis without hearing from their doctor. This is why it's important that we work with our patients so they can decide what they would want. Some patients will want to be notified immediately, while others can choose to wait on certain lab results and test results until they've heard from their doctor. We're going to put them in control of this. As providers, we're used to delivering sensitive news directly. And we know that some patients may want to continue to receive it that way. And we'll do our best to do that. We've been working to let our patients know what's coming and how they can share their preferences in a number of ways. Through information on MyChart, informational posters at practices, and most importantly, talking with their providers. As I said earlier, nearly half of our patients have already signed up for MyChart. I'd like to encourage all our patients who haven't signed up yet to learn more about it. It's secure, it costs nothing to sign up, and it helps you partner with your healthcare team to manage your health. To learn more and to sign up, go to mychart.urmedicine.org. Thank you very much.
Thank you, Dr. Apostolakis and Dr. Mendoza. This is Dr. Rob Mayo. I'm pleased to be a part of this conversation, and thank you for this discussion today to support our community. As has been mentioned, the 21st Century Cures Act was passed a number of years ago, and like many laws, there is a time horizon at which different steps of it are implemented. And so both UR Medicine and Rochester Regional Health will be implementing this important part of the Cures Act on its appropriate timeline. Rochester Regional Health will also be releasing all results immediately as the Act requires. This will be occurring at the beginning of November in the Rochester Regional Health System, and will be available on an ongoing basis from that date forward. I do think it's important for the public to remember that many results, medical results, require interpretation beyond what may be written in the record. And so if you receive results before your physician has had an opportunity to speak with you, please be sure that you write down the questions that come to mind. If you've done any additional research that you want to discuss, have that ready as well, so that you can have a fully satisfying dialogue with your doctor to answer your questions and concerns. There are times where some results can appear very foreboding or worrisome, when in fact a more complete clinical interpretation may not lead to that kind of a conclusion. So please be cautious as you receive these results to avoid any undue upset or strain, but come prepared so that those conversations can be really meaningful and be supportive of you and your family. We look forward to the continuing collaboration that this act facilitates between our patients and our providers, and feel that this act and compliance with it is a step that brings meaningful dialogue to the healthcare setting. So thank you very much.
Okay, we're now going to open up for on-topic questions, one per reporter, and we're going to start with Rebecca Fath from WROC.
Hi, happy Friday, everybody. So I guess my question is, it's kind of personal. As someone who already uses my chart and finds it to be a really effective tool, and it has been an effective tool for me for a while, I already was getting test results as soon as they were available. I already had a dialogue with my doctor. So it's, I'm kind of wondering, I think today, what's new, and I think I'm perceiving that what you're saying is what's new is that you're in place, ready to go along with these guidelines already, and that when people have a choice whether or not they want the results right away, and then just to make sure that they're communicating with their doctor. But it's been a good tool for a while, so I guess I'm just kind of wondering more of like what exactly is new other than you're in place, ready to go.
Well, I think that's a great question, and what's really different, there are some sensitive test results that are not now released immediately. Most notably imaging, so CT scans, MRIs, PET scans, and also pathology where a doctor does a biopsy. And potentially you could receive a life-altering diagnosis like cancer and receive it at the same time the doctor receives it, and therefore he or she hasn't had a chance to talk to you about it. And therefore you're at home and you get this result, and I'm sure you want to talk to your healthcare provider, and you haven't had that conversation. Right now we hold it back for a certain period of time to assure that the provider is able to talk to you and let you know what the results mean and what the plans are. And as Dr. Mayo alluded to, there are certain things that aren't necessarily black and white, but could be concerning on a CAT scan, that really it's difficult for a patient or someone who's not familiar with these scans to know what it means and what the plan will be in the future. So that's what we want to let patients make a decision about. Do they want all the information, even if it may be concerning and the doctor hasn't had a chance to talk to you, or do you want to wait for the sensitive information so you can have a conversation with your healthcare provider?
Doctor, is that as simple as going onto your chart and clicking something, or is this paperwork you have to fill out through your doctor? How do people actually make that decision? Can they just go onto their portal?
Yeah, you would actualize it with your healthcare provider, and they should be talking with you about that.
Okay,
Thank you.
A reminder, this is a one-question round. Andrew Banis from 13 WAM, you're up next.
Good morning, everyone. Happy Friday. Good to see you all virtually here. So Rebecca asked, really, that was what I was wondering too, kind of the difference. But in addition to that, wondering, are you guys seeing a lot of people locally in both healthcare systems and Dr. Mendoza, just with the Department of Health, who are asking for this, who want these options? Have you encountered that with patients? And that's part of the reason why you're making sure this is something that's going to be available.
Well, as I mentioned earlier, this is a change that's really been a change in the making. This is now required by law, but I think we've been ahead of the curve locally. We've been rolling this out in phases ever since, five years ago now. And I'll just say that from my standpoint as a clinician, my patients have enjoyed this. This is a way for me to communicate with my patients, and they have been able to see a lot of results. And we know that some results aren't always easy to interpret just when you look at a number or a value. So this is a change that is both required and a good change.
To add to Rebecca's and Andrew's questions about what else is changing, the access to a broader selection of notes will also be changing. So there'll be many categories of notes that doctors write, whether they be progress notes, histories, physicals, consult notes, other types of summaries, procedure notes will also be available. So this law expands access from results to a much broader swath of the medical record, so to speak.
Okay, thanks, Andrew. WXXI's Randy Gorman is next.
Yeah, hi, Julie. I'm good for this round. I just have a couple off topics I'll do later.
Okay. Jennifer Lukey from WHEC.
Hi, everyone. I'm wondering what the typical turnaround time was and is for a lot of these tests. And before, you talked a little bit about how much of the information was already available immediately. What is immediately? Is it a couple of days? Is it a couple of weeks? And it just sort of shoots there so they have it. Do your doctors are worried about time management with this? I know if I got something in my chart that was troubling, I would be on the phone right away to the doctor. And if he wasn't available, I'd be calling every 10 minutes. So is there a concern from the doctor standpoint about managing this new requirement?
Yeah, great questions, Jennifer. The release time really depended on the test, and many tests were almost immediate or within 24 hours of them becoming available. For imaging and for pathology, there was approximately a 7-day wait, which gave the clinicians a chance to make sure that they contacted the patient to discuss any findings. There are some physicians and providers that are very concerned about this, and they're concerned that that patients will get information without the context of its meaning, and so there is some concern. But I think, as Dr. Mendoza pointed out, I think that the paternalism in medicine is ending, and people are recognizing this is really patient's information. It's their chart, actually. It's information about them. They own it. They've paid for it, and the results of tests are really theirs. However, I think we'd all acknowledge there is potential for troubling news to be given to patients when they're not really prepared or to fully understand it. So I think we need to let our patients know what to expect, and then to go into this with their eyes wide open. And I believe some patients will ask for their information not to be released until their physician has had a chance to talk to them. But let's leave it up to the patient to decide that.
Thanks, Jennifer. Wendy Wright from Spectrum. Can't hear you, Wendy.
No.
Okay, we're gonna give Wendy a minute to find her microphone, and we're gonna go to Joe Lasky from WHAM 1180 if he's not on air. Looks like he might be. So Patty Singer from Minority Reporter.
Yikes, I had to find my microphone. So issues about context, concern about context has been an issue since Open Notes started many years ago. At the time then, there was concern that people wouldn't understand the text that was written. What is being done to annotate these notes, whether it's text or imaging, to help people understand? Because in a way, you're asking patients to sort of do their own brain surgery with this, and as medical people, you don't want that. What's going to change in Open Notes to add context?
Well, Patty, I'll respond initially. Thank you for your question. We're not asking patients to interpret their medical information. What we're saying is you may have access to it, and we as providers want to have a full dialogue with you about it. So I don't think any physician will want their patients to conclude entirely for themselves what these results, what these notes mean. And you're right, the context really matters. And I do think that there will be some learning over the next several months as providers receive feedback from their patients that, oh, you know, this didn't make sense to me. And then they will begin to learn how they can be clear in the notes to reduce the number of questions or to minimize angst about things that are unclear in the record. But I think that will be a mutual learning experience. And naturally, different patients have different levels of understanding. So I anticipate that will be customized between doctor and patient.
Thanks, Rob.
Wendy, do you want to try?
Yeah, can you hear me? I had to hop out for a second. Did it work?
And you're on.
It made me update my Zoom. Okay, so I just wanted to know how much everything with COVID really pushed this along, if it did, and how much of a difference this time we're living in is making this warranted.
Well, I'll jump in. COVID has really accelerated our adoption of telemedicine. I think we're learning that our patients are finding it very acceptable. And unfortunately, it's because there's an urgent need for it, but this has sort of ushered along the adoption of telemedicine. And I think we're finding that a lot of patients are in some ways more comfortable talking with us from the comfort and safety of their own home. They don't have to negotiate transportation issues. It's in many ways more convenient. So, you know, I think this is an advance that we've inadvertently been preparing for as a result of COVID.
I would also say from the Rochester Regional Health perspective, we've seen huge increases in the dialogue through MyCare. So there's been a lot of interest in this. So I do think that the adjustments we've all made to the COVID pandemic have greatly accelerated the use of technology in many ways.
Thank you.
All right, now we're going to start another round of questions. Please keep it to one question per journalist due to the time constrictions that we have, and we want to make sure we get everyone's question in. Direct your question to the person you would like to ask it, answer it if possible at the beginning of your question. So we're going to start again with Rebecca Path from WROC.
Hello again. So this question is for Dr. Michael Mendoza. I think a big question on everybody's mind right now is the governor's statement about how if the numbers go up, we're all going to have to close down and go back to where we were last year at this time. Businesses just people working, parents, it's kind of the top of everybody's mind. What is your take on that, Dr. Mendoza? Like, where are we? I mean, obviously we're in New York State, so the governor is going to be, but we've done well here in Rochester for the most part. So do you have any kind of prediction, or can you make a prediction about whether or not we're actually going to have to close down again?
That is a question that's truly on everybody's mind, including my counterparts across the state. And what I would offer is that, we need to control what we can control, and that is our own behavior as individuals, as families, as workplaces, and as a community. There are a whole host of changes that are happening at the state level, and in large part due to a reaction to what's happening downstate. We know that what's happening downstate in many ways is very different from what happens up here, but certainly we'll feel the ripple effect of anything that is implemented downstate up here in Rochester and Monroe County. So what I would offer is, for now, let's keep doing all the things that we can control. We are currently looking through all of the cluster guidance, trying to figure out how to adapt that to our local community. And thankfully, we have no need to right now. We are not seeing anything near the types of surges that are being seen downstate. And so to some degree, that gives us some time to prepare and to look ahead.
Thank you, Rebecca. Andrew Banas from 13 WHAM, your question is next.
Hello again. My question for Dr. Mendoza as well. Wanted to ask about vaccine. I know that's a question we've all had since the very beginning, but as we get further along and we start to hope that maybe this is sometime next year or the spring, how do we determine how we will distribute that locally? Who will be able to have access sooner? Healthcare workers, things like that. Are these questions you guys are already starting to work out? And if so, what does that look like?
Thanks for your question, Andrew. I'll clarify. I'm assuming you're asking about a COVID vaccine. Is that correct?
I am. Yes. Thank you.
Yeah. So we're a long way from a COVID vaccine here in this community in the United States. We want to make sure that any vaccine that's developed and ready for prime time has gone through all of the proper science for ensuring that it is both effective and safe. So we do have plans that have been on the shelf for a long time. They're called point of dispensing plans, and they have to do with dispensing influenza vaccine or hepatitis vaccine. And these are plans that we've implemented in the past. But what we don't have yet is guidance as to who at a federal level is going to be considered priority for administering these vaccines. So we have the mechanics in place, but we don't have the clinical guidelines because the vaccine doesn't yet exist.
All right, thank you, Andrew. Randy Gorman from WXXI, your question is up now.
Hey, thanks, Dr. Mendoza. How are you?
Good. How are you?
Good, good. I don't know if this was a mistake or there was the governor holds very often these phone conferences with media, and in his press release yesterday, he had the Finger Lakes region at a 1.3% infection rate, and yet when Cuomo was talking, he talked about the Finger Lakes as being 0.3. I know we've traditionally in recent weeks been always under 1%, and I wondered if you knew which was accurate, and if it is over 1%, is that a cause for concern?
There have been typos on some of those slides in the past, and I saw that as well. I wasn't sure if they were referring to a one-day number or a rolling 7-day average. Our numbers locally show that they have not changed to that degree. We're still seeing in Monroe County a rolling average of about 0.7 to 0.8%. But any increase would be concerning. And when I saw that, of course, I did want to double check that because it would have been a surprise if it was true. But based on all the data I'm seeing, I don't think that that 1.3% is accurate.
Okay, thanks.
All right, Jennifer Lukey from WHEC.
Hi, I have a question that I'm hoping Dr. Mendoza you can address, and also Dr. Mayo and Dr. Apostolakis. One question for all three. That's how I get around my one question rule. No, I'm wondering, we're hearing from a lot of parents. I'm a mom. I brought my kid to the pediatrician, and she said they are overwhelmed with COVID tests. And she told me that there's a backlog, a bit of a testing backlog, because as we went back to school, anyone with sort of any symptom is being tested. I know the rules changed a little bit last week about the regulations with that, but are we seeing a delay of a day or two or more because there are so many COVID tests being run because of back to school? And what is sort of the solution here?
So I'll start by offering that when we look at the numbers, there certainly has been an increase in demand for tests. Best I can tell, the turnaround time has not changed all that much, which speaks to the systems in our community being able to keep up for now. But the change in guidance last week does allow, thankfully, for clinicians to utilize their clinical judgment in ruling in or ruling out COVID-19. But the reality is, it is very hard to distinguish COVID-19 from any other infection. And so while it is good that the clinicians have that latitude, I don't really think that we're going to see a major decrease in testing as a result of these changes in guidelines. So with that, I'll ask Dr. Mayo and Dr. Apostolakis to comment on the testing.
I would just say that the testing turnaround times in our internal laboratories have remained the same, mostly less than a day, but some of our testing does get sent out to reference laboratories, and that can take 3 to 4 days. So turnaround times haven't changed, but they are not immediate in all cases. And so testing volumes will potentially impact that in coming weeks and months as well. And as we do more flu testing, that will also be factored in.
Yeah, I can tell you that our labs do around 2,500 up to 2,500 tests a day with back to school, both for colleges, in grade school, high school, et cetera. New mandates for nursing homes. Our labs have been stressed. Now, the vast majority we get done within 24 hours. And the ones that are critical for patients in the hospital or those that are symptomatic are usually hours. However, there are times where our labs get stressed. And recently we had one period where it took up to 72 hours to get the test back. Right now, we're not sending to reference tests. We're doing them all here, or reference labs. We're doing them all here. But within the last couple of weeks, our lab was extremely stressed. Right now, it's all less than 24 hours.
All right, Wendy Wright from Spectrum.
Hi, Dr. Mendoza, question for you, really from some people in the community who are concerned about their loved ones in nursing homes. They are calling on you specifically to help them be able to get their message to the state, to Howard Zucker, to the governor. They have not been successful in reaching them, and they want your help. They want you to help them send the message that they want an independent investigation into what's happening with the nursing homes, but also to have the governor understand that they want to have somebody, at least one person from a family, be able to get in after these 7 months and see their relatives and their, I don't know how much you realize how upset they are. They're very concerned about the deterioration of their relatives, and they are extremely upset that there are special investigations or teams or whatever task force for going back to see the bills, opening restaurants, but there's no task force or effort, as they understand it, to open up nursing homes. They're turning to you now, today, and asking for your help. What do you say to them?
I totally get it. It is what we are seeing in the nursing homes is extremely difficult, both for the residents as well as their families. I take care of patients in the hospital. I've seen patients who come from nursing homes, who need to go back to nursing homes, who are extremely lonely and who are suffering from disconnection from their family and their loved ones. I totally get it. This is an area where, you know, we are in a sticky situation in that, unfortunately, I don't really have any authority over nursing homes. This is something that the State Department of Health has full authority over, and I've shared my message with the people that I usually share my message with at the state and the governor's level. And this is something that I think we need to continue to work on. I think the message is clear, but we also know that the high risk nature of nursing homes, and I think we have to balance that. And we have to balance the fact that not everybody in a nursing home has the same preferences about their goals of care and the types of risks that they're willing to entertain. I do hear from people on the other side of the spectrum, if you will, people who say, please do not allow visitors into the nursing homes. And I think those families have a right to their preferences being heard as well. So this is not just a one-sided issue. I do understand, though, it is extremely difficult. And I've said many, many times that mental health is so important in navigating a crisis like this. But I totally understand where they're coming from.
All right, Joe Lasky, are you with us from WAM 1180? Okay, Patty Singer, we'll finish up with you. Patty Singer from Minority Reporter.
All right, thank you. There was a lot of attention paid early to COVID demographics in underrepresented minority neighborhoods. With flu coming up, will the flu data be broken down into racial, ethnic, and even neighborhood level as we saw early on with COVID, so that we know if we're getting these kind of twin pandemics happening?
Yep, that's something that we can do.
Okay. Well, that was quick. Thanks. I'll be looking for that.
Okay.
Wrapped up?
Yep, very good. Well, again, I want to thank you all for your time this morning. Thank Dr. Rob Mayo and Dr. Michael Pasalakis, both for your time on this call, as well as your partnership throughout all of this pandemic. And thank again all of the media who are working so hard to deliver accurate messages to our public. So with that, thank you all. Have a good weekend. And,
Wait, can we get one more, Dr. Mendoza, about the increase in case at RIT? I see Wendy wants it. We were looking for that too.
Increase in cases in RIT, they're all asking now.
Oh, the RIT. Oh, so they've seen, I think, 3 more cases at RIT. I think RIT has done a fabulous job, and I think they're raising alarm bells prematurely in some respects to raise awareness and sort of throw caution up. But like all other cases, we look to see that there is a full explanation of contact tracing, and they identify the cluster. We've seen a number of clusters here in Monroe County. You've seen, slight upticks in the numbers since the beginning of September, but these have all been large clusters that we've been able to identify through EpiLinks. And so RIT is doing the same thing. And so you're hearing more about it because there's more transparency, which is a good thing. But overall, the numbers really haven't changed much since late summer. All right. Thank you all. Have a good weekend.
Thank you.